Welcome to another episode from Optic Surgeon, the ophthalmology podcast. Today we're diving into bilateral painful loss of vision. It's a really alarming experience, right?
Yeah,
And we want to help you understand the potential reasons behind it and maybe unpack what makes this specific combination of symptoms so significant.
absolutely. I mean, when you have pain and vision loss affecting both eyes simultaneously, well, that immediately signals something potentially more widespread.
Right, more than just a single eye issue.
Exactly. It helps us narrow down the possibilities quite a bit, compared to vision loss without pain, or maybe problems just affecting one eye.
Okay, so when someone comes in with this bilateral painful vision loss, what are the sort of initial categories of problems we start thinking about?
Well, one key area is definitely a cornea. That's the clear front surface of your eye.
Okay.
Things like significant dry eye or something called superficial punctate keratopathy.
Hmm.
Basically, tiny little breakdowns on the surface.
Uh-huh, like little scratches or erosions?
Sort of, yeah. They cause irritation, blurred vision, and can definitely affect both eyes and be painful.
Makes sense.
And then, of course, trauma. Direct injury to both eyes could certainly lead to this.
Injury to both eyes, yeah, that seems straightforward enough. But you also mentioned consensual photophobia. That sounds interesting.
It is quite interesting. It's where light entering, say, your good eye actually causes pain in the other eye, maybe one that's been injured previously.
So light in one eye triggers pain in the other.
Yeah, even if the vision loss is currently worse than the eye letting the light in, it's like the nerves in that injured eye become hypersensitive.
Wow, so a sort of cross-reaction from past trauma?
Exactly. It's a
Yeah.
fascinating neurological link.
Okay, really interesting. So beyond the cornea and direct injury, what other types of conditions are we looking at?
Inflammation is a big one. Uveitis, which is inflammation inside the eye.
Inside, okay.
Yeah. That can definitely affect both eyes, be quite painful, and significantly reduce vision. And interestingly, some autoimmune conditions can actually make someone more likely to get bilateral uveitis.
So it can be linked to overall body health sometimes.
Very much so. It highlights how eye problems aren't always isolated.
Right. Uveitis sounds serious, affecting those inner parts.
What about optic neuritis? We hear that term quite a bit with vision issues.
Yeah, optic neuritis often comes up. It can cause vision loss and often involves pain, especially, when you move your eyes.
Pain on movement, right.
But here's the thing, about 10% of the time, it can actually be painless.
Oh, really? Painless.
Yeah. So if you have bilateral painful vision loss, but maybe not that distinct pain when moving the eyes, while we don't rule out optic neuritis completely, we might lean towards other possibilities first.
Okay.
The presence, I guess the type of pain, are really crucial clues for us.
Got it. So the pain characteristics really matter. Are there other specific conditions that jump out for this combination? Herpes zoster ophthalmicus. That's shingles affecting the eye area.
Singles, right.
Specifically involving the nerve that supplies sensation to your forehead, eye, nose area, the first division of the fifth cranial nerve. That can cause really significant pain and potential vision loss.
And that can be bilateral. I thought shingles was usually one-sided.
It usually starts on one side, that's true, but because of the nerve pathways involved, it can sometimes have bilateral effects or complications.
Okay, that sounds incredibly painful. Now, what if there's a headache involved too? Does that change the picture?
A headache alongside the bilateral painful vision loss, yes, that's a really important piece of the puzzle.
How so?
Well, migraine is a classic example. It's obviously known for headaches, but it can also cause temporary visual disturbances, sometimes quite dramatic ones, and pain.
Right, visual auras and such.
Exactly. So if you're experiencing both headache and these visual symptoms, migraine becomes, a more likely possibility, though we still need to be thorough.
Of course, rule out the more serious things first.
Always. But it shows how these symptoms can be connected.
Right, the body system's talking to each other.
Yeah.
What about conditions that maybe start in one eye but could end up affecting both?
Yeah, that's important too. Like endophthalmitis, that's a severe infection inside the eye. It typically affects just one eye. But, theoretically, in very rare situations, maybe after procedures on both eyes or something systemic, it could occur bilaterally.
Okay, rare but possible.
And similarly, acute angle closure glaucoma. This is where the pressure inside the eye shoots up really suddenly.
Very painful, I understand.
Extremely painful, severe vision loss usually starts in one eye. But the underlying anatomy that makes one eye susceptible often exists in the other eye too.
Ah, so the second eye is at risk.
Exactly. It could develop the same problem maybe simultaneously or maybe later on, so it can become a bilateral issue.
Okay, that makes sense. So even if it starts in one eye, gotta watch the other.
Yeah.
When someone actually presents with this pain and vision loss, both eyes, what are the absolute must-do diagnostic steps?
Well, a really comprehensive eye exam is paramount. Absolutely crucial.
What does that involve?
We need to look very closely at the cornea check for any damage, dryness, lesions. We have to measure the pressure inside both eyes accurately, the intraocular pressure,
Pressure check.
and then a detailed examination of all the internal structures, the lens, the retina, the optic nerve. It's about getting that complete picture of what's going on physically inside both eyes.
A full inventory, basically. What other information is vital?
The history is key. How did it start? Was the onset sudden or did it come on gradually?
Okay.
Are there other symptoms, like you mentioned headache or maybe extreme light sensitivity, photophobia, any other neurological signs, tingling, numbness, anywhere?
So the timeline and associated symptoms.
Exactly. They're like pieces of a puzzle. They help us narrow down the possibilities and arrive at the right diagnosis. The details really, really matter here.
Okay. Now, for anyone listening who might, heaven forbid, experience something like this, when is it time to, drop everything and seek immediate medical help?
Honestly, immediately. It's vital for you to understand that bilateral painful vision loss is a true eye emergency.
Emergency. Oh,
Yes. Conditions like that acute angle closure glaucoma we talked about, or a severe infection like endophthalmitis, these can cause rapid permanent vision loss if they aren't treated, well, basically right away.
so time is absolutely critical.
Time is absolutely of the essence. If you experience this combination of symptoms, pain in both eyes, vision loss in both eyes, you need to see an eye care professional immediately. Like, go to the emergency room or an urgent eye clinic. Don't wait.
That's a really clear and important message. Don't wait.
Mhm.
So as we've sort of walked through, this symptom complex bilateral painful loss of vision can stem from a whole range of things, from surface issues like dry eye or injury,
Right up to internal inflammation like uveitis.
or even things linked to the nervous system like shingles or potentially migraine.
Exactly. And the type of pain, how fast it came on, any other symptoms, those are really key for diagnosis.
Right. But I think the crucial point for you, the listener, is that this combination of symptoms should absolutely never be ignored.
Never.
Prompt, professional evaluation is essential.
Mm-hmm.
It's the only way to figure out the underlying cause and get the right treatment started quickly to hopefully safeguard your sight. We really hope this deep dive has given you some valuable information on this pretty critical topic.
And maybe just one final thought for you to consider. Think about how your body often gives signals. Pain is a signal. Vision loss is a signal. Having both together, especially in both eyes, that's a very loud signal that something significant is happening and needs immediate attention. So listen to those signals, pay attention, and don't ever hesitate to seek that professional help when needed.